Say you're calling in sick to work, or you're telling your friends you're not going to make it out because you aren't feeling well. Isn't it a lot easier to tell them you have a cold, or even worse, a broken arm? What if it's something else? Something that can't be seen, or there is no blood test for? Something like depression. We all worry about our heart health, and we watch what we eat, but do we stop and think about our brain? Major depression disorder affects 6.7% of the U.S. population 18 years and older. That is 14.8 million adults. And women are more at risk than men. Before we understand what depression is, we need to look at what depression is not. Recently broke up with a significant other? Or down because of a fender bender? This is not depression. You're bummed that you didn't get the job? Or in a bad mood over something going on financially? This is still not depression. If you have a change in mood that relates to something going on in your world, it is not depression. However, over time, this change in mood can lead to depression. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, depression is 2 or more weeks in a depressed mood or a loss in pleasure, causing distress in social, work, and other important areas of functioning. This cannot be caused by an external substance and must be distinguished from grief. The classifying characteristics of major depression disorder include depressed mood, diminished pleasure in almost all activities, a change in weight and appetite, difficulty getting out of bed or trouble sleeping, overly jittery, a loss of energy, feelings of worthlessness and guilt, diminished ability to think or concentrate, and indecisiveness. Additionally, any thoughts of death. Depression is caused by a number of things, such as genetics, biological, environmental, and psychological factors. There can even be a physical change in the brain or neurotransmitters that play a factor in creating this mood disorder. Changes in the body's hormones may trigger depression. Inherited traits, life events, and early life trauma are more common causes. However, these factors must fit the criteria previously mentioned. If you or a loved one are dealing with depression, it can impact everyone around you. It is important to talk about it. Find hope with your friends and family. If a depressed mood does not improve over the course of a few weeks, seek help. The sooner you or a loved one has help, the quicker everyone will feel better. For more information about depression or mood disorders, visit the National Institute of Mental Health at nimh.nih.gov. And for more information about helping a loved one, visit familyaware.org.